Hello and welcome. Today we're diving into a rare but important topic, urethral neurofibroma. This condition, while uncommon, can have significant effects on urinary function and overall quality of life. Join us as we explore its symptoms, diagnosis, treatment, and more, offering a comprehensive overview of this fascinating disease. The exact cause of urethral neurofibroma remains largely unknown in most cases. These benign tumors are thought to arise from Schwann cells, which form a protective sheath around nerve fibers. While sporadic mutations may be responsible for some occurrences, urethral neurofibromas are more commonly associated with neurofibromatosis type 1, also known as NF1 or von Recklinghausen's disease. NF1 is a genetic disorder caused by a mutation in the NF1 gene, which leads to uncontrolled growth of nerve tissue. Thus, individuals with NF1 have a higher predisposition to developing neurofibromas in various locations, including the urethra. The pathophysiology of urethral neurofibroma involves the proliferation of Schwann cells within the urethral wall. As these cells multiply, they form a mass that can impinge upon the urethral lumen, causing obstruction. This obstruction leads to increased pressure within the bladder and urinary tract, potentially causing hydrutor and hydronephrosis, which is swelling of the ureter and kidney due to backflow of urine. The tumor can also irritate or compress nearby nerves, leading to pain, altered sensation, or even erectile dysfunction. The degree of obstruction and nerve involvement dictates the severity of symptoms. Without proper treatment, the chronic obstruction can result in irreversible kidney damage. Urethral neurofibroma is a very rare condition, making precise epidemiological data scarce. Its occurrence is much more frequent in individuals with neurofibromatosis type 1 and F1. F1 itself affects approximately 1 in 3,000 to 4,000 individuals worldwide. However, the percentage of NF1 patients who develop urethral neurofibroma specifically is not well documented, further highlighting the rarity of this specific manifestation. While urethral neurofibromas can occur in individuals of any age, they are often diagnosed in adults, reflecting the time required for the tumor to grow and cause noticeable symptoms. Research efforts are needed to better understand the true prevalence and incidence of this condition. The signs and symptoms of urethral neurofibroma can vary depending on the size and location of the tumor, as well as the degree of urethral obstruction. Common symptoms include difficulty urinating, weak urinary stream, urinary frequency, urinary urgency, and nocturia, which is excessive urination at night. Patients may also experience dysuria or painful urination. In some cases, the tumor can cause urinary retention, where the bladder is unable to empty completely. Depending on the extent of nerve involvement, individuals might experience perineal pain, groin pain, or even erectile dysfunction. Due to the tumor's proximity to other pelvic organs, it can rarely cause bowel-related symptoms or discomfort. It's important to note that these symptoms can overlap with other urological conditions, making accurate diagnosis crucial. Diagnosing urethral neurofibroma typically involves a combination of clinical evaluation, imaging studies, and tissue biopsy. Initially, a doctor will review the patient's medical history and perform a physical exam, including a neurological assessment to look for signs of neurofibromatosis type 1. Urinalysis and urine culture are done to rule out infection as a possible cause of the symptoms. Imaging studies such as ultrasound, MRI, and CT scans can help visualize the tumor size, location, and involvement of surrounding structures. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the urethra, allows direct visualization of the tumor. Ultimately, a biopsy is necessary to confirm the diagnosis of neurofibroma. A small tissue sample is taken during cystoscopy and examined under a microscope to identify the characteristic features of a neurofibroma. While urethral neurofibromas are typically benign tumors, they can vary in size and location within the urethra. There aren't specific established classifications or types based on tumor characteristics. The most important factor is whether neurofibroma is associated with neurofibromatosis type 1's NF1 or occurs sporadically. The presence of NF1 significantly impacts the overall management strategy, as individuals with NF1 may have multiple neurofibromas in different locations and require comprehensive monitoring and management of their condition. Treatment and management of urethral neurofibroma depend on the size, location, and symptoms caused by the tumor. The primary goal is to alleviate urinary obstruction and relieve symptoms. In some cases, if the tumor is small and asymptomatic, observation with regular monitoring may be sufficient. However, if the tumor is causing significant symptoms, surgical removal is usually the preferred treatment option. Transurethral resection of the tumor, or TUR, involves using a resectoscope inserted through the urethra to shave away the tumor. Open surgical excision may be necessary for larger or more complex tumors. If the tumor is associated with neurofibromatosis type 1, a multidisciplinary approach involving specialists in genetics, neurology, and oncology may be required. Pain management, bladder training, and medications to improve urinary function may also be part of the treatment plan. As urethral neurofibromas are often associated with neurofibromatosis type 1, preventing the condition itself is not possible, as NF1 is a genetic disorder. However, genetic counseling is crucial for individuals with NF1 who are planning to have children. This counseling can provide information about the risk of passing the NF1 gene to their offspring. For individuals with NF1, regular medical checkups and screening for neurofibromas in various locations, including the urethra, is important for early detection and management. Adopting a healthy lifestyle, including maintaining a healthy weight and avoiding smoking, can help manage overall health and potentially reduce the risk of complications associated with NF1. The prognosis for urethral neurofibroma is generally good, especially when the tumor is completely removed surgically and is not associated with neurofibromatosis type 1. In cases where the tumor recurs or is associated with NF1, long-term monitoring is necessary. Recent research is focused on developing targeted therapies for neurofibromatosis type 1, which may indirectly benefit individuals with urethral neurofibromas. These therapies aim to inhibit the signaling pathways that promote neurofibroma growth. Additionally, advances in surgical techniques, such as robotic-assisted surgery, may improve the precision and minimize the invasiveness of tumor removal. Clinical trials are ongoing to evaluate the effectiveness of new treatments for NF1 and its associated complications, including urethral neurofibromas. Continuous research efforts offer hope for improved outcomes and quality of life for individuals affected by this condition.